So now we are live streaming on Facebook and LinkedIn. And just give me 1 second. Give me 1 second. Now, thank you very much, Tim. So, my friends, we're here with the great Dr. Tim MacAdams. He is the medical director of the San Francisco 49ers, and he's getting ready for Super Sunday tomorrow. This is the 58th Super Bowl that is going to be played in Las Vegas. And fortunately, we have him right now with us. And we want to ask him a lot of questions, but we have limited time. So we're going to do our best just to know what's happening around a professional football team before just a Super Sunday. So, Tim, thank you very much for accepting this interview. And please, first of all, what do we know from you?
Well, great to see you again, Michelle. It's been a while, but we go way back with our traveling fellowship together, which was a great time. I think back in 2007. So
Yes, 17 years ago.
yes. So yes, I'm, as you said, medical director, head team physician, orthopedic surgeon for the San Francisco 49ers. I'm also a clinical professor at Stanford University in sports medicine, Department of Orthopedic Surgery, and currently function as the president of the American uh, National Football League Physician Society, and that's a 2-year term. So I'm serving that now. So kind of overseeing all of the healthcare issues among all the team physicians.
That sounds like a lot of responsibility. So, can you share with us, as in your role of medical director of the San Francisco 49ers, what do you have to do day after day?
Well, it really does take a village, and so it's not just me. It's that we generally have 2 orthopedists per team. We have 1 or 2 medical physicians per team, and then beyond that, there's multiple ancillary care physicians, whether it's chiropractic, massage therapists, physical therapists, acupuncturists, athletic trainers, and so it does take a lot of people. And then on game day, there can be over 20 physicians, where you add to those airway physician, an emergency response physician, independent neurosurgeons that will evaluate for head injury, and all of our paramedics. And we'll have a ophthalmologist on available. We'll have a dental physician, dental dentist on available. And so it does take a village.
No, definitely, it sounds like. But in any weekday, what do you do? Do you have to be in practice, or just someone is reporting to you what's going on with the team?
Okay. Yeah, typically for American football, you really need to have people at practice, and there are injuries that occur there. So different than other sports that I've covered. And then on game day, you're with the team on game day and on every traveling game as well. And there's a couple of reasons for that. One is it's a rough sport. And
Yes.
so there are injuries, and so my skills as an orthopedic surgeon are often necessary to evaluate and to manage people. A typical week, Monday is generally the big day. If we presume a game is on a typical Sunday, the Monday is the big game because you really have to look at all of the injuries, where we usually get a handful of MRIs and see up towards 15 to 20 patients
Wow.
the next day. And so most of them are fairly minor, but there are always a few that need more attention. And figuring out whether they can practice that week, whether they can play the next game. If not, how long will they be out? And then once that cascade starts, then you start talking with the coaching staff, and you start talking with management to make a plan, and then the players' agents. And so one player may involve, for example, on a hamstring injury, could involve over an hour of work
Wow.
once after you've established the diagnosis and talked to the player, just because all those other boxes have to be checked and close the loop on everything else.
Wow. So it sounds like a really, really a lot of work. But especially this Sunday is going to be a little bit more responsibility. So how do you prepare the players health wise? Do you do something different for the Super Bowl in comparison for the rest of the season, or it's just another game day?
Yeah, no, the key is to do absolutely do it the same way you've done it all your life and all year, and not change a thing. And we all kind of know that as physicians, when we start changing our protocol, start changing the way we address issues, and sometimes we, as we call VIP care, and try to cut corners or say maybe this will be okay, that's when problems arise. So really, what I teach my partners and fellows that help is do it the same way you do every time. Don't let the moment get to you, and it would be same for the athlete. They got to do their job the same way they do every time. You can't look up and see, oh, this is even a bigger game. How many millions of people are watching?
Yeah.
You'll freeze. You won't do your job well. And so it's no different in medicine.
A very good friend of mine is a radiologist. She specializes in MRI, and she was asking me yesterday to ask you if you do any routine MRI just before this game, just to discard any injuries, or you just have to trust in your clinical instinct.
No, it's clinical instinct at this point, and they've got one game left. The career length for NFL is averages about 3.4 years, so they have limited time. So if they have a window, and now this can be a lifetime opportunity for many of these players. It is my third Super Bowl, so I've been fortunate being here 16 years to see this, but many of them it may be their one. Many of them never get to experience it, and so to go off of anything other than clinical just wouldn't make sense. As we know, MRIs can show a lot of false positives, and you have to correlate that clinically anyways. And so MRI would really
Yes.
not dictate that. And so when it comes to this game, it really MRIs are less important.
Great. Any other routine imaging study is also based on your clinical instinct, I suppose.
Absolutely, absolutely. And so, fortunately, we're in a pretty healthy situation as all teams, say, they have the public injury reports. And not everything is public about when you publish those injury reports, but um, what I would say is that there's no team at the end of an NFL season who feels perfect, and the players will tell you that is they've got something, they've got a little bit of soreness here or there, and so
Yes.
you get through a 17 game season, you're going to have some soreness, then you add on some additional games after that. So there's issues going on, but fortunately, the people can see from the injury reports that we're doing fairly well.
Great. And well, with regard to the injuries, what are the most common injuries you diagnose and treat for any American football player? And at the end of the season, are you seeing it just a little bit different frequency of each injury?
The most common, and this goes all across the NFL in public data, is basically going to be the high ankle sprains, the hamstring strains, and the knee sprains, including ACL. And so those would be the big three we're trying to target in terms of prevention of injury. We can get to those. Those account for a significant amount of lost time compared to a lot of the others. Yes, a quadriceps rupture is a terrible injury. Yes, a pec tear is a terrible injury, but those are just the smaller numbers. And so if we can focus on these soft tissue strains, especially hamstring, but also adductor and quad strains, as well as high ankle sprains and ACL, and try to lower those numbers, we'll be making big headway.
And how do you prevent them? Talking about that.
Well, it's a work in progress. And so as you know, if we take the ACL, there's a lot of great prevention programs, but the people are still going to tear their ACL. And so the key is to get people to buy in that, yes, it does look that the data shows these help. And a lot of these based on prehab and optimizing the kinematics of the cut and pivot and all the proper muscle firing. And a lot of technology has helped with that as well. And then the other big part, especially with soft tissue strains, is appropriate ramp up period. The days are over where people just show up from their hometown to camp in August and have not worked out at all. And so they all have worked out. The problem is, Michelle, is you can't compare. Once you get to live practice, you can simulate that all you want in your gym at home before you come into town. But once you start battling against other people for a job and this is your career, it just goes up another level. And so we
Yes.
do still have an issue with the ramp up period, but we're working on that. And it does seem to be very clear that a good progressive ramp up period is helpful to diminish soft tissue strains.
And from what I can hear, you don't have to do many surgeries on your players, but you have to be on them just to prevent some injuries that could evolve to an injury that can require a surgery. Isn't that right?
Yes, and I do surgeries on our team, and it does. There are a handful each year, no matter what, and some of those we have a really good system in place with some second opinion physicians, and so sometimes the agent will direct them to another physician to do the surgery, but we still do a lot of the surgeries here at Stanford. And the key is these are professionals, and the key is to attain and maintain their trust, and you do that by giving them your opinion, tell them what you think you is best to do, and then and encouraging additional opinions, and then they can go where they want to go. But then we oversee the rehab, and so that's the key thing is to maintain that trust is by really providing the care that they need and doing some of the surgeries and not doing some of the surgeries.
That's good to hear. And we're at the end of the season, and so all the players are experiencing all these work that they have done all throughout these 5 or 6 months. But in particularly talking about stress, mental stress, do you think the Super Bowl can have some impact in terms of the health of mental health of your players, and does this have to behave differently on your players?
Yes, I think everything's magnified in the Super Bowl, but I think it's not much different from the Super Bowl from the rest of the season. There's fortunately an increased awareness of the importance of mental health optimization, and these players are on television weekly and have a lot of stress in various areas, whether that be confidence within themselves, whether that be family issues, or other issues. So in 2019, the NFL initiated the behavioral mental health clinician program. So each team has a physician that's there, a clinician that's there 10 to 15 hours a week and
Okay.
helps with these. And so that's been great, kind of normalizing mental health optimization, if you will, rather than not seen as a problem, but just like we would go to physical therapy to help rehab our quad strain, we want to optimize our mental health as well.
And as a medical director of an NFL team, how do you involve in these mental health issues? If you have a clinician that is working specifically in this.
Yes, so you help. I help organize it and help, and then stay out of their way. Let them stay in my lane. I know about what I do, but they're professionals of what they do, and so you get everybody properly vetted, and then you get feedback from players at the end of each season. But the key thing is to let for a big system like this to work, you have to let everybody do their job,
Yes,
and so that's really important. But you have to make sure they're doing a good job, and so that's part of what I oversee.
great. Does do your players follow any specific nutrition or fitness regime, or are they planned individually? I mean, with this, do your players follow the instructions of the team, or in some cases they have like their own personal coaches?
Do they eat their broccoli like mom told us we had to? Yes, so I do find that they follow. We have two nutritionists that do a great job and very thorough, and it's providing the information for them. So the majority of them all do follow that program. But absolutely, by this point of their career, they know their bodies, they know what works for them, and so there may be some kind of molding of the finer points, but they have a pretty good grasp of nutrition these days when they're coming out of these top colleges where they have a good program to start this. So, but nutrition is a big part of it for sure.
and in terms of strengthening programs, do they
Yeah, similar
follow?
thing. Similar. I'd say that's very similar to nutrition, right? You have some people that really just want to do everything according to what the strength and conditioning group feels like at that particular club where they play, and others they know what works for them by now, and there can be tweaks here or there.
Yeah,
And it's interesting with technology now, maybe looking at somebody you say, look, we need to get you a little bit more leverage coming up from this angle to that angle. So we're going to work on this. And so that's where a lot of those groups are studying to see to optimize performance is a fascinating arena. So the players they all want to be the best they can be,
of course.
but they also don't want to just follow a program because it's the program that their club tells them to do. It has to be a two-way street.
Tim, you have been working with top elite athletes for many years now. Um, what would you say is the most rewarding part of your career in your present role?
Well, I would say like times like this, like the Super Bowl, are really exciting. As I said, this is my third one, and it is fun. Don't get me wrong, um, but I will say that that uh, a lot of team physicians will do that for game day to kind of get that juice, that excitement of game day. But those physicians where that's the most important thing to them never last long, because once the lights die down, everybody goes home, and those players see you kind of go home as well, the trust is gone. And so to me, the most rewarding is players that know that I'm in it for the long run, for their health, their family's health, and a proponent of optimizing their health and their future during their career and after their career. So what's the most rewarding? A former player calling me and saying, "Hey, I moved back to the area, or I'm in this different area. Can you help me with this, or this, my
Okay.
health?" And that to me is incredibly rewarding.
You have taken care of athletes from very different sports. What can you say these athletes from different sports look like, alike between them, or are very different according to the sport?
Yeah, I mean, I've been head team physician for the Golden State Warriors in the NBA. Been team physician with the San Francisco Giants, also San Jose Earthquakes, and so very different sports among those. So sometimes I'd love to get a power forward from the NBA and come in and be a wide receiver for us for the 49ers and just see how that body type works, right? But they do all have a little bit different body types, but it's so variable within position, right? So they're all great athletes. I would say that, as I mentioned on the outset, my skills as an orthopedic surgeon are most useful with American football. I'd put rugby in that category as well, hockey, because there are the rough nature of the sport. There are injuries which I can help, whether it's reduction of a joint that comes out of place, whether it's fracture management, or whether it's a sprain or strain or tear of ligaments or tendons. So you just a higher number of those where I'm more needed. Although I enjoy the other sports as well, I don't think that the orthopedic surgeon is as critical. I think you could have a good physio and a good primary physician helping with that, and then have an orthopedist on call. The other big reason why that's the case is there can be over 150 games for
Yeah.
Major League Baseball and many over a high number of games for NBA. Football, you have 17 games. So that's why you don't travel with NBA or MLB as a physician. You can easily just pull the player out and say, "Hey, we'll see him in the clinic next week."
Yeah.
But for football, you have to make a decision on return to play that day, and
Yes.
it can be a very important decision, and you have to make that right call. And so it's very difficult to trust another team, not trust, but um, put that on another team physician that
Yeah.
doesn't know the player, doesn't know their history, and has to make that call for them. And so it's really critical to do that for football.
For anyone that has worked with top level athletes, they can find that it is a very rewarding job, but it is also very challenging. So, how do you manage to balance your professional and personal connections with your players and also with a coaching staff?
Yeah, I think it's remain professionalism. Is if you keep your professionalism and they know that you're there for their health and that's why you're there, then you will maintain that trust. And it's the same with the coaches, same with the players. Yes, every once in a while, someone will make an extraordinary play, and I'll see someone will catch me kind of clenching my fists and smiling and getting emotional about it. But I say, okay, momentary lapse. That was exciting. But the reality is, the players and the coaches don't want a fan on the sideline. If you're a fan, it won't last long.
Okay.
You can be, you can root for the team because you see how hard everybody works. They put in countless hours. So of course you want them to do well, but you can't be a rah-rah fan. It won't work out.
Well, definitely. Um, what advice would you give a young physician and a young orthopedic surgeon that is looking to pursue a career in sports medicine and is looking to become this high profile to fill this high profile position as you have right now? Because it's very challenging also.
Yeah, so two things. One is mentorship. And so when I was in college at UCLA, I had a mentor that was taking care of the teams, and I really kind of thought that would be really great to do. And so as I was going into medical school, I really kind of targeted that area and found that that was something I really wanted to do. And the mentor can show you the way. Unfortunately, there's not a lot of mentors out there for the group that are struggling with the diversity. So we've established a pipeline group with the NFL Physician Society and the NFL in cooperation to have a student from the historically black college university in the States to come and shadow each team for a month during the preseason to try to get that pipeline because without a mentorship, I had a person that looked like me, talked like me, acted like me, and just kind of say I could see myself doing that. But if you don't have that visual, then that's hard to do. So I think that'll improve a lot. Orthopedic surgery and some other disciplines in medicine have struggled with some of the diversity issues. So we're really working hard on that. The second part of it is to do a good job, be a team player, and work hard. If you do all those things, you will keep rising to the level of your ability. You can't have a target of saying, I need to be the head team doc for the
Yes.
49ers. You have to do good work, meet people, build relationships. That's how I got my job. I started out working with Stanford teams, got to know some of the athletic trainers. They were making some shifts. A lot of it's timing. And so you can't have that be the guide of whether you're successful or not, of whether you attain that position that you visualize. But if you do good work, you'll just keep rising higher and higher.
Definitely. Um, what do you see the role of sports medicine is going to evolve in the future, particularly in football? You talked to us about some technology that are using just for injury prevention, but how do you see, with some specific examples, how it is going to change the scenario?
Well, the first thing is management of game day injuries is already changing in terms of twofold. One is the video replay booth that we have, get called down from our ATC spotters, can give me feeds. Everybody at home can see the game better than I can. With over 20 HD cameras from different angles, you can see that ankle sprain, the mechanism of injury, and I'm trying to peek around a 300-pound lineman to see the play. And so to be able to go over and look at that makes a lot of sense. And so that's helped. The other is that the players often would not want to be evaluated on the sideline. Of course, they don't want the camera seeing them. They don't want, it's just not a good look. And so the blue tent we have now where we can go in and look at them is great. Keeps them from having to go all the way back to the locker room, but they don't want to do that either, right? You get cold,
Yeah,
you get stiff, you want
yeah,
to keep moving. So it's a great way to do that. So those are two in-game changes that have been made that I think are really helpful. In terms of the future, you mentioned it's about performance and optimizing performance, and that's still a work in art to see how is best to do that. But I think that more and more clubs are having a performance expert, where we have Ben Peterson overseeing all of that and works with Dustin Little, our head athletic trainer, and it's fantastic because they can oversee all of these new technologies to see what works and what works for us and what doesn't work for us.
great. Um, who do you think is going to win the Super Bowl tomorrow?
Well, of course, I hope the 49ers win, but I think if anybody's watched a few minutes of any NFL football game this season, they can tell you that who the heck knows, right? Anything can happen in the NFL. So we'll see, but hopefully it'll be a great game and a great battle.
And tomorrow is going to be particularly a stressful day for everyone. Are there some specific advices you can share with us about managing the stress of being on the sideline for a Super Sunday tomorrow?
I don't feel it, and I feel, of course, I want to win, and some of the parts you just have gratitude for some of the excitement that's around you. But once it starts, you have to be that focused, just as the players have to be focused. And if you let any of that affect you, it just changes. And I really don't feel that I've been asked that many times, even just regular games when there's people in the stands or cameras. You don't know where those are, you don't know who's looking. So if you just focus on it and not think about any of that, you'll be fine.
Sounds like a very wise advice. Thank you very much, Tim. Someone just asked me to ask you if you think having Taylor Swift at the stadium is going to change something.
Yeah, I may miss some of the plays because I'm going to go searching for her because my daughter really wants me to get a selfie with her. So, um, no, again, all of that is great because it makes it a lot of fun, gets people to tune in that may not be interested in the sport in the first place, but all of that is noise to the players and the coaches. They're so dialed in and focused on their job, and so I want to do the same thing.
Great. And you told us a little bit about it, but once the Super Bowl has finished, we already know who is going to be champion, and the season is off. So how do you manage this time off season with your players?
Uh, well, once the season's over, then you do the checkout physicals and get a program going for everybody if anybody has any health issues that are going on. And then the only disadvantage of going to the Super Bowl is that we have our combine evaluation of over 340 college athletes going into the NFL next year that starts in Indianapolis in 2 weeks. So not
Okay.
a whole lot of time off. And then after that, we do all our homework in terms of going through all the MRIs and their injury history and to the draft in April. So July is the time to get away. So if you want to do anything with me, that call me in July.
Great. Tim, we're having a question from the audience, and if you have any advice on these elbow orthoses that can be used for playing a game, especially in players that have already experienced an elbow dislocation.
Yes, I think they work great. The players tolerate them really well, at least for football. And there's lots of different brands. I don't think it depends on the brand, but it basically you find what motion is comfortable for you. And let's say that's 20 to 120 degrees, then that's great, and they can remain functional. You put that on. You always want to have it put on in practice first, so they get used to it and see, no, I need a little more extension or a little more flexion. You have that negotiation of what's safe for their particular injury, and go through it. So the interesting thing is some of these players that wear one for the injury, they'll keep wearing it the rest of their career. They just like it. They just somehow gives
Oh,
them that feeling of power and don't mind it at all. So I've been surprised on the elbow braces how well tolerated they are.
wow. So in terms of orthosis that can be used while playing, there is no custom fit orthosis. You use the off-shelf options?
Sometimes, but we'll modify those at times. But there are absolutely are custom options as well, and you really have to look at the player because a lot of it depends on factors of their position, what is their injury, and so. But we use custom orthoses all the time as well.
Okay. Any particular brand, or just depending on the player?
Yeah, nope, just depending on the player.
Great. And we're almost getting to the end, but I want to ask you, do you recommend any meditation or focusing technique for you and your players?
Short answer is I don't know. Again, I stay in my lane. That's not my area of expertise, but I will tell you that is a increased focus within the NFL and all of these athletes. And so we do have different people as part of that village I talked about at the beginning that do look at different ways to do that. I know there's a lot of different approaches to it, which I'm not an expert in, so I don't want to go into it. But how can you deny that that's not important? Anybody who's ever tried to hit a golf ball, or anybody who's tried to focus on a big case the next day for surgery, is like you have to be get dialed in mentally, and so to optimize that just makes sense.
And this probably is going to be my final question, Tim. You're right now as president of the NFL Physician Society, and you definitely are in a position to know which is going to be the direction in which the sport is going to change in terms of injury prevention, or especially in terms of any sequel that may have these head microtraumas. What can you tell us about this?
Well, I think the first thing is just acknowledging that these are issues. I think for a while that was kind of, you think of when I started in 2007, our evaluations of concussion and diagnosis of concussions was very different. And it wasn't that we didn't care, it's just that we didn't have the focus on that, and it was just part of the game. And since these kids grew up, and so that's the first thing is recognition that there are issues there and acknowledging that we can do better. And I'd say that's the same with ACLs. Of course, there's going to be a re-injury rate, but just because there's going to be a re-injury rate no matter what, doesn't mean that we shouldn't try to get better.
Definitely. Tim, thank you. Thank you very much. Is there something that we may have missed in this interview that you will
No,
want to share with our audience?
no, I just really appreciate it, Michelle. It's great catching up with you, and
Thank you.
be well.
You too. Good luck tomorrow, and hopefully you may have a Super Bowl ring on this third Super Bowl game that you're going to be at right now.
Thank you, my friend.
Thank you very much, Tim. Take care and enjoy.
Bye bye.
Bye bye.